A new COVID-19 vaccine is here in Oklahoma with more on the way. 66,200 doses of the Moderna vaccine arriving in the state today. This as Tulsa Fire Department members received their COVID shot. 6 sites received a part of that shipment today, and 21 other sites will get them tomorrow and Wednesday. This as Pfizer's vaccine continues to be administered to frontline healthcare workers. 2 Works for You's Brady Halbleib joining us now live with a closer look at the new vaccine and some of the key differences between the two. Brady?
Karen, thank you. Moderna's vaccine will be especially beneficial for Oklahoma. Pfizer's vaccine needs to be stored at -90 degrees, while Moderna's vaccine only requires it to be stored at regular freezer temperature. This will make it easier for rural hospitals and pharmacies that don't have that ultra-cold storage capability to store Moderna's vaccine.
The effectiveness and the side effects from the vaccine are quite similar.
OU Chief Medical Officer Dr. Dale Bratzler says so far there's virtually no difference between the Pfizer vaccine and the Moderna vaccine, and you'll likely not have a choice between the two when it's your turn. But there are some key differences in how it's stored and distributed across the state.
There are a limited number of places across Oklahoma that have the freezers capable of the ultra cold storage that's required for the Pfizer vaccine.
Pfizer's vaccine needs to be stored at -90 degrees Fahrenheit, whereas Moderna's vaccine only requires regular freezer temperature.
Which will make it much more convenient when we start thinking about distributing it to rural Oklahoma, through pharmacies, through physician offices, and other places.
The side effects for Moderna's vaccine is similar to how you'd feel after Pfizer's vaccine. Bruising or soreness at the injection site, mild fever and headache, and fatigue. Both are also mRNA vaccines, injecting a non-active piece of the virus, helping your body build antibodies.
Because you're only receiving a piece of the genetic code of the virus just long enough to make those cells that eat the vaccine.
And the time between both doses differ by 1 week. Pfizer requires 3 weeks between doses, while Moderna requires 4. Pfizer's vaccine is stable for 5 days after being taken out of storage. Moderna's vaccine remains stable for 6 times as long. And the age requirement for the vaccination differs by 2 years. Pfizer's vaccine is available for everyone 16 and older, whereas Moderna's vaccine is available for everyone 18 and above. And for people who have a history of allergic reactions to vaccines,
we're actually suggesting to them that they take one of the non-drowsy antihistamines, such as a drug like Zyrtec, or take it 2 to 3 hours before they come in for the vaccine.
Still, we are months away from the vaccine being widely available to the general public. This as the State Department of Health continues to vaccinate everyone in phase 1 of the state's vaccine plan. Another interesting fact, Dr. Bratzler also mentioned older adults have shown to have lower side effects than younger population. Dr. Bratzler also tells me both vaccines present same chance for allergic reactions, but it's not something to worry about when getting a vaccine. Brady Halbleib, 2 Works for You.